Advantages of breast milk composition. Carbohydrate breast milk 7 mg per deciliter, cow milk 4.5 mg per deciliter. Proteins breast milk 1 mg per deciliter, cow milk 3.5 mg per deciliter. Adequate amino acid like cysteine, taurine, methionine for CNS development in breast milk, and breast milk is richer in whey protein. Lipids, PUFA, DHA in mother's milk, minerals, calcium phosphate in breast milk such that favors the calcium absorption, iron present in breast milk more absorbable. Vitamin D and K are deficient. B12 also. Vitamin D is given 400 international unit, vitamin K 1 milligram. It is 7% of water contained in the breast milk. Anti-infective substance in breast milk. Tech for lab. T TGF beta, P phagocytic macrophage, L lactoferrin lysozymes, A antibodies like IgA, B bile stimulator lipase. Breast milk protects against disease like in neonate NEC, neonate sepsis, older age group asthma, obesity, diabetes, allergies. Breast milk fed babies have higher IQ, help in maternal and child bonding. Variation in composition of breast milk based on time after birth. Based on time after birth, colostrum first 72 hours, thick yellowish. Transition milk for next 2 weeks, and mature milk thin and watery. Based on gestational age at which the baby is delivered, preterm breast milk is richer in sodium, immunoglobulin, protein, iron, calories. Based on each feeding session, fore milk initially watery part satisfy mainly thirst, hind milk thick part comes out at end rich in lipids satisfy hunger. Mother is recommended to feed from one breast completely before switching to the other so that the baby receives both fore milk and hind milk. Micronutrients, vitamin A, earliest symptoms, night blindness, earliest signs, conjunctival cirrhosis, can be conjunctival ulcer or even blindness. Therapeutic dose less than 6 months 50,000 international units, 6 to 12 months 1 lakh international unit, greater than 12 months 2 lakh international unit. 3 doses given: first at the time of diagnosis, second after 24 hours, third after 14 days. For prophylaxis, 6 mega doses given starting from the 9-month 6-month interval. Zinc. Dermatological manifestation: acrodermatitis, enteropathia, presenting later part of the infancy, present with the diarrhea, dermatitis, rashes everywhere, glossitis, conjunctivitis, hypogonadism. Treatment: administrations of zinc therapy. Malnutrition. Best indicator of acute malnutrition: decrease weight for height, wasting. Chronic malnutrition: decrease height, stunting. WHO classification of malnutrition: weight for height between 2 to 3 Z score or 70 to 79, wasting less than -3 Z score or less than 70% of expected, severe wasting. Height for age between 2 to 3 Z score, 85 to 9%, stunting. Less than 3 Z score or less than 85 or expected, severe stunting. Edematous. Quasiauricular edema present, apathy present, appetite is poor. Marasmus, appetite is good. CNS, apathy, lethargy, and CNS is active and alert in marasmus. Hepatomegaly is seen in Kwashiorkor. Skin and hair cells more common. Skin flaky paint, hair flax sign. Severe acute malnutrition 6 months 5 to 5 years. Severe wasting less than 70%. Weight for height less than -3 z-score. Mid upper arm circumference less than 11.5 cm. Symmetrical bipedal edema of the nutritional origin. Treatment: initial hospitalization. Look for complication and treatment. Complications are shielded, sugar deficiency less than 54 mg per deciliter, 10% dextrose, hypothermia, infections, electrolyte disturbances, dehydration, deficiency of micronutrients, nutritional rehabilitation. F75 diet, 75 kilocalorie per 100 milligram and 0.7 gram of protein. F100 100 kilocalorie per 100 milliliter. Fluid and electrolyte: first 10 kg 100 ml per kg, next 10 kg 50 ml per kg, beyond 20 kg 20 ml per kg. Maintain fluid N/2 in 5% dextrose or DNS with 1 milliliter of KCl per 100 milliliter. In neonate, BW greater than 1500 grams, start with 60 milliliter per kg. Bone weight less than 1500 grams, start with 80 milliliter per kg. By 1 week 150 milliliter per kg. First 48 hours 10% dextrose, no electrolyte. Greater than 48 hours N/5 in 5% dextrose. Management of shock: normal saline 20 milliliter per kg up to 3 minutes. Dopamine first line, dobutamine cardiogenic shock, non-epinephrine warm shock, epinephrine cold shock, IV antibiotic septic shock, catecholamine resistant shock, IV hydrocortisone given.